Good morning. This is Dr. Pranav Rathi. I'm one of the orthopedic surgeons who specializes as a shoulder surgeon. I practice in Juhu Andheri in Mumbai. Today I'm going to talk about impingement syndrome and rotator cuff tears. These are pathologies pertaining to the shoulder which commonly affect middle-aged to older individuals. For the benefit of the patients, I have a shoulder model with me here. Okay, so this is the shoulder joint. These are the muscles. The subscapularis, the supraspinatus, and when we turn it around, the infraspinatus. These constitute the rotator cuff. This is the acromion, which is the bony process. Now we can easily make out that whenever we try to move this, these muscles run under this bony prominence. With age and degeneration, sometimes there are extra bony prominences which grow on the undersurface of the acromion, and these dig into the tendon. When this keeps happening, this causes a lot of pain, especially when you are doing overhead activities like removing something from the top shelf. If this is neglected at that point, then this continuous rubbing on the bony surface causes the tendon to become weak and it finally tears. That is called a rotator cuff tear. If you neglect a rotator cuff tear, which causes a significant weakness in the movements of your shoulder, then your joint goes into arthritis. And this arthritis is accelerated. What I mean by that is, normally if a 70-year-old gets an arthritis, somebody with a rotator cuff tear can get it 10 years earlier at the age of 60 or 55 when you are really not that inactive and you really want to use the shoulder, isn't it? So that is the reason why we should tackle these things the moment they are diagnosed. Now, the surgery to create more space under the acromion is called subacromial decompression. It is done arthroscopically with just 2 stitches. Okay. At the same time, if we find a rotator cuff tear, we can repair it using special suture anchors which go into the bone on one side and have threads on the other side to take these rotator cuff and bring it back to the bone. And that is how you can tackle it with a minimally invasive procedure. Unfortunately, many patients come to me who have missed this bus and they have already had arthritis in their shoulders. Now, these procedures will not work to take away the pain of arthritis, in which case you will require a shoulder replacement. Therefore, it is essential that you tackle these problems as early as possible to avoid a more invasive and a major surgical procedure like shoulder replacement. Hope this information was helpful. For any further information or any queries that you might have, please contact me via Lybrate.